Hi, my name is Dr. Lina Shaar. So I'm here today to give you a bit of information and maybe some tips about taking care of your teeth and your gums while you're pregnant. So tip number one for you is prevention. And that means that before getting pregnant, if you can, visit your dentist and your hygienist. Your dentist to get a full checkup for your gums, your teeth, your jawbone. If you have any hidden cavities, any large cavities that could possibly give you a problem while you're pregnant, pain or otherwise, it should be treated as soon as you can before getting pregnant. And to visit your hygienist to remove any of the calculus or debris that's on the teeth that could be causing gum disease. Gum disease is very crucial, especially if you're pregnant, because it could go through your bloodstream and into your baby's bloodstream, which could cause premature babies or premature labor. But basically, it's so important to get a cleaning done before and during pregnancy. So prevention as much as you can is so important to keep your pregnancy and your baby healthy throughout. So tip number two, you want to keep up with the hygiene even at home and in the dental office, okay? You want to come in every 6 months for the cleaning. It's so important, especially during your pregnancy, because with the gums being very inflamed from the hormones, there could be swelling, there could be redness, there could be bleeding. And the cleanings really help to reduce that as much as we can. So when you're brushing as well, you want to make sure that you brush with fluoridated toothpaste, okay? I know sometimes with the nausea, especially in the first trimester, I get a lot of patients that tell me they can't brush, the fluoride makes them sick, but try as best as you can to brush for 2 minutes each time in the morning and at night, all the surfaces really well. And if you do experience nausea or vomiting, just kind of give yourself a bit of a half-hour break to let the saliva neutralize. And then the pH level can become a little bit more alkaline and you can brush better. You don't want to brush straight after vomiting. That acidic environment can be damaging to the teeth. And flossing is so important to do once a day at night before you sleep. Flossing is what's going to help to save your gums and to save your teeth, especially during pregnancy, to remove all that harmful bacteria so it doesn't go through your bloodstream and into your baby's bloodstream. So tip number three, it's the diet. So what you eat is very important during pregnancy for you and for your baby's health. So you want to eat healthy foods such as fruits and vegetables, cheese, nuts, and you want to make sure that you lessen the amount of sugar or acidic foods that come from juices, soda, even carbohydrates that can break down into hidden sugars, because that affects you, it affects your teeth, and it affects your baby. So you want to try to be as best as you can with a healthy diet. And make sure you drink lots and lots of water. Water is always washing the mouth and washing the debris and the bacteria that's on the teeth. And that helps to also neutralize the pH level in your saliva again, because an acidic environment causes the bacteria to form a cavity. So drink lots and lots of water throughout your pregnancy, and you can even use sugar-free gum and xylitol containing chewing gum, and that helps as well. So tip number four is professional oral care. I get a lot of questions from pregnant mothers and breastfeeding mothers of what's safe to get done and what's not safe in the dental office. So basically, try to keep up, first of all, with your checkups and with your cleanings, as we've said before. Dental treatments can be done at any time throughout the pregnancy, but we still limit it to doing it during the second trimester mostly, because in the first trimester, you could be nauseous, you could be feeling just uncomfortable in the chair, so we kind of avoid it unless it's needed. And then in the third trimester, you could be feeling very big, very heavy, pressure in the back, so you want to kind of avoid long treatments, long appointments in the dental chair. So we try to you do it in the second trimester if the pregnancy is going well and everything is smooth. So having said that, if there is an emergency and severe pain, we need to address that pain as soon as possible. Treatment can be done. So we do have anesthetic that is completely safe for pregnancy and for breastfeeding. And x-rays, a very common question, can actually be taken during pregnancy, but we still try to avoid it only for emergency cases. Okay, so if you do have any issues, you have to seek dental treatment right away. at least a consultation just to see what's going on, if treatment can be delayed for after or if it should be done right away. Another treatment that a lot of patients ask me about is whitening. We prefer to do whitening after the pregnancy and after breastfeeding. So in general, after saying all these tips, the most important thing that I want you to keep in mind is to keep up with your dental checkups and your dental hygiene. Okay, every 6 months, as best as you can. So I hope all these 4 tips have helped you today. For more information, visit drmichaels.com, the website, and we can help you answer all the questions that you have. Again, please make sure that you keep up with your dental visits and your hygiene visits. That's what's going to help you and your baby to have a healthy pregnancy and healthy breastfeeding stage throughout.